Welcome to CFP Distilled February 2023. My name is Dr. Simon Moore.
And I'm Dr. Paul Dillon.
So we're taking all of this and condensing it down because we know you're busy. You want to know the basic summary of the most important articles. What are they?
So we're going to start off with an article about nutritional deficiency and dementia.
We're going to talk about Parkinson's pointers for the non-tremor features. We're going to take a look at good SAM opportunities for those.
And at the very end, 2 quick hits on mono and a medication to use or not use. And then a quick hit on some recent updates on Menorrhagia treatment.
And so, as we always do, let's start with our cover critique. And so this is, I think, is actually a beautiful painting, better than like the oil drums we saw on some of those other covers. What do we got here?
I think it's actually a challenge for a lot of the rest of Canada. We're from BC. We've got beautiful green grass in February. So it's a bit of it's a bit of a challenge for some people to realize where these people are, but they're obviously in BC. Beautiful background or not? What's that in the background?
Yeah, we got a cloud rolling in, which represents dementia. So you want to tell us that story. This is a fascinating case of someone, they thought it was dementia and it wasn't.
So over 90-year-old female, didn't want to go to a care home. She loved to go out and have a chat at her local shop, but all they had there, they had bread, they had crisps, some crackers. That's all she was eating. Ended up having a drop in her MoCA score. Eventually got admitted to a care home and perked right back up. So nutritional deficiency due to food insecurity. So a great reminder in a SU or in a SAMP to ask about everything. Ask about all those social determinants and think about nutritional deficiency in your elderly patients if you see a decline in maybe dementia.
Exactly. Keep that differential diagnosis broad. So let's take a look at Parkinson's disease. Again, people come see us and we're worried about their tremor because that's what we see, but they're more concerned about this symptom list. So what's the first one?
So let's start head to toe. What about depression, anxiety, and sleeplessness?
You got it. So how do we treat depression, anxiety? It's 35% of folks with Parkinson's have it. You know the answer, SSRIs, SNRIs.
So let's move on, keep moving down. What about sialorrhea?
Exactly. Sialorrhea, dysphagia, 2 common situations in people with Parkinson's. For both of them, you can refer to speech-language pathology. But when it comes to medications for sialorrhea, what are the options?
So you could use Botox, botulism A injections, chewing gum, or even ipratropium bromide spray. So 3 options for sialorrhea.
Now let's get back up to being backed up. Constipation in people with Parkinson's. Again, you know how to manage it, but make sure you do because 80% of those folks have it.
It is not hard. We're going to go with PEG or...
Did you even mean to make that joke?
I did.
Okay.
It's PEG or lactulose. So no major changes. Your standard approach to constipation, use it in these patients, but just consider it.
You got it. Okay, moving on to another symptom. People with Parkinson's have...
orthostatic hypotension. So what can you do for these patients? You can reduce the antihypertensive they might be on, consider changing their movement, so take a pause when they're doing sit to stand, abdominal binders even in some of these patients. So lots of options.
And the last one would make a fantastic SAMP. People with Parkinson's may have restless leg syndrome. What is one condition you want to rule out so you make sure this isn't causing it?
Iron deficiency anemia. And then what are you going to do to treat them? This could be a side effect of the medication they're on. Maybe they're on an antipsychotic. Maybe they're on antidepressants, and that's a side effect. So lots of different ways you can manage this and also offer stretching before bed. Simple management.
And pregabalin, I believe, also mentioned in the article as helping with RLS. So let's change gears a little bit and move on to our last 2 quick pointers. The first one is going to be menorrhagia. Do we use an IUD or an IUS to treat menorrhagia?
So great evidence, good summary. I think this is fairly well known at this stage, but I've seen it in my patients. So an IUS system, better than oral contraceptive, bigger decrease in bleeding, and pretty significant effects re-illustrated in this article. So that's your go-to for patients with menorrhagia, IUS.
Fantastic. And our last article from CFP Distilled, a pediatric population pointer pearl on people with mono, which 90% of us have antibodies to, apparently. So if you got a patient with mono, do we give them prednisone?
The answer is no. For pain, which is what the article specifically addresses, small inconsistent benefits for steroids, but can you name maybe one situation that you might want to consider using it?
Yeah, exactly. Really important to know this. If there is airway compromise, get that swelling down, get those steroids in. Now, there's a couple other complications of mono we need to know about as well. So if their blood count is abnormal, their platelets are going down, you've got thrombocytopenia or autoimmune hemolytic anemia, do we use prednisone in those cases?
So in those cases, yes, it is indicated, but I'd be wanting to talk to specialists and maybe a pediatrician at that stage as well.
We are here in Toronto for our Spring 2023 review course, and we've got fantastic news about our Summer 2023 review course. If you're writing the fall CCFP exam, what is it?
So we're going to be back here in Toronto, great city, but also we've been able to drop the price for the course. So we're super excited to see more and more people attending the course in Toronto near the end of August this year.
So look at thereviewcourse.com/register and find out how you can come to the review course at a lower price than we've been able to offer in a long time. COVID looks like that ship is sailing away, hopefully. And so we hope to see you in Toronto at the review course summer 2023.